And so I'd like to kind of proceed a little further into honoring someone who had a huge impact on our lives. I don't want this to be about me, so I've invited some other people up here to talk about how Dr. Fletcher impacted their life as well. And then, of course, Dr. Julie Famberg-Smith will be presenting the Achievement Award from our society. So just to give you some background, how do I know Dr. Fletcher? Well, and I learned a lot about him after the fact. So I was a resident at the time at Wake Forest University. I was interested in bone and soft tissue. There was a dermatopathologist there named Dr. Wayne White. And I was trying to figure out, well, who do I want to go study with, right? So there was a number of names that came up. But I remember this dermatopathologist said, well, you should go talk to Dr. Chris Fletcher. He just wrote this paper on pleomorphic malignant fibrous histiocytoma, basically debunking what was at that time considered to be the most common sarcoma around, right? And he basically said, most of these, first of all, they don't really have true histiocytic differentiation. And most of these, if you apply IHC and look at morphology, there are other things, right? And it was really challenging some concepts at the time, which really became part of his legacy, right? It wasn't just that, but that was kind of the beginning. So anyway, I happened to see him at 1992 at the USCAP meeting. And I went up to him and I said, hey, can I come train with you, right? And he said, sure. It didn't charge me anything to do it. I said, sure, I can come there. I took a credit card out. I was a resident at the time. I paid to stay in the Nuffield College of School of Sciences, I believe was the name of it. It was just a wonderful experience. Shared an office with Dr. Thomas Mensel. I don't know what he's here, but huge impact on my life. Not only did papers come out of that, book chapters, opportunities to be involved, like with the WHO. You all know, you were impacted by him, right? Just a fantastic and absolutely wonderful experience. We didn't do selfies back then. I have lots of pictures. I don't have a picture of me and him, so all I could do was show you my ID and the kind of mullet-like haircut I had back there, right? So anyway, I was trying to kind of model myself after Rosenberg, but I just couldn't pull it off, right? Just couldn't do it. I'm going to scroll through some of these. I want to explain this a little bit because this is some of you may not know who CHAMPS, what that organization was. That was an org, before we were talking about fusions, and what I learned were basically the translocations, right? So to this day, I'll be talking to our fellows and I'll mention a translocation. They don't have any idea what I'm talking about because they've memorized the actual fusion product. But this was a group of highly esteemed individuals from multiple institutions who sought to karyotype bone and soft tissue neoplasias, and really ultimately formed the foundation for what the talks you heard earlier today. So I'll just kind of go through these slowly. These were various pictures that were sent by various people, and I wanted to kind of thank them for that. Just a few of these before I invite some people to talk about a few words about him. So. Anyway. And this is a great video, by the way. I did not know that when I met him at USCAP in '92, that was his first trip to the US. I'd never do that. Plus, I saw that video, It was my first USCAP. I stole this from Christina's Facebook page, just to let you know, which was attributed to Jason Hornick. That's my confession for the evening. This is my favorite picture of all, right? I know we have members of his family here, and I really want to thank you for coming to this event, right? I mean, it came a long ways. You will undoubtedly see that I've posted up like the objective criteria of Chris Fletcher, the objective things that he did. He published lots of articles. He was just a human force that I just can't imagine how he was so productive. But I think when as his legacy is finally written, what we're all going to mostly remember is how he helped us. You know, that's what he did best. I mean, a lot of people, we have many members at his meetings who published lots of articles who've done, but not many that can say they were a force to be reckoned with, both at the human level, mentoring level, and at the productivity academic level. And he really was. And that's what I'll remember him for. Not the 600 journal articles, but how he impacted my life. So with that, I want to invite Drs. Hornick, Dr. Joe, and Dr. Nascimento to come here and please say a few words and take a back seat.
It's really a pleasure to be here. We've had lots of events over the last year honoring Chris Fletcher in so many places, in so many ways. And just to say a couple personal words about him, I came to Boston for the first time to interview in 1998. I met Chris Fletcher. I had no idea who he was. I have never heard of soft tissue pathology. And I thought I was going to be a scientist, and that very quickly changed when I started training with Dr. Fletcher. He had such incredible passion and warmth, and every time sitting around the microscope, everybody had so much fun. It was such a different experience. It wasn't like work. It was wonderful. It was happy and hilarious and so educational. And I feel so lucky to have spent my entire pathology career working with him. He was my mentor. He really formed my career in so many ways. We shared an office suite for many, many years, and we would go into each other's office and show each other cases and essentially say, am I crazy? Does this make any sense? And of course, we'd always agree with each other. Because he trained me, so as he liked to say, I was brainwashed to agree with everything he said. And he really became one of my closest friends, and every day going into the office is so difficult because he's not in the room next to me. Thank you.
So first, thank you, Scott, for inviting me. And I had promised myself there wouldn't be tears, but it's just plain impossible. So like Jason, I first met Dr. Fletcher when I interviewed for residency at the Brigham, and Jason and I are from the same year at residency, even though I look much better than Jason. But as Jason said, when I first met Dr. Fletcher, I knew what pathology and soft tissue pathology was because of my father, but my heart was set on heme path. I started pathology at the Brigham wanting to be a hematopathologist, but I slowly, as my dad would say, got brainwashed by Fletcher and fell in love with soft tissue pathology. And decided that even though I did do a fellowship in heme path, I really decided that my passion was soft tissue pathology. So, and as Jason mentioned, I had probably the best years of my life sitting around the multi-headed scope. It was so instructive. We learned so much, and we had so much fun with all the inappropriate jokes that were told around that microscope. Those were definitely the best years. I was on maternity leave and, going out of my mind with, newborn twins at home, and I would just go in to sit at the scope and, and have some, fun, because that was really my happy place. So as Scott pointed out, Dr. Fletcher was, an incredible force in the field of pathology, and we'll all remember and be able to, do a Google search, PubMed search, read all thousands of papers that were written. But I think for me, the most important part that probably, I've been very privileged was to know Dr. Fletcher as a human being. He truly cared about every single person that was in that room. every time I had to make, I'm so sorry. Every time I had to make important decisions, not only on my professional life, but even in my personal life, I always called him. He was always available to, to help, to give his opinion, to, guide us. So that is, I think, what I'm going to miss the most. And I still can't believe that he's just not there when we need it. But anyways, he'll be forever someone who was so, so important to me, not only on a professional level, but on a personal level. So thank you, Scott, again, for giving me this opportunity. Thank you.
Well, thank you again. I actually wrote remarks. I always stressed Chris out by how I would show up to lectures unprepared, and so I thought I would do it the way he'd want. Before I read, it dawned on me as we were up here, both Jason, Alessandra, and I all have twins, and you can imagine Dr. Fletcher had some choice commentary about that fact. In our field, the name Christopher Fletcher is synonymous with just an amazing career and gargantuan accomplishments. And it's of no surprise that everyone who speaks about him, all these quantifiable achievements, we're all talking about the things that he impacted us in immeasurable, more day-to-day, ordinary ways. And, every day at work without him is still very difficult for me. And for many others at the Brigham are feeling the same. And it dawned on me just really how much Chris Fletcher brought the extraordinary into our everyday lives, and how his talents also helped people in ways that we just can't archive or quantify in any way. And we think readily of his incredible work ethic and his diagnostic brilliance. And many of us are lucky to have experienced his limitless generosity as he mentored and supported and shaped the careers of many of us in this room. Empathy and kindness came naturally to him, but he still put in an incredible amount of work in helping others. He had a gift for making people feel seen and valued. We saw him greet every lab technician, administrative assistant, support staff by name and with respect in the hallways. He met with every resident and fellow in the program every year to plan their training and help them find jobs, often calling departments and practices around the country on their behalf. As you know, he had a day job running anatomic pathology. He was a tireless advocate for our field and for all faculty individually. He made himself available to anybody seeking his guidance and advice. We all came to him to discuss hardships and struggles. It was often simply enough to talk to him about it, but when necessary, he went to great lengths to help any of us. He routinely met with patients who sought his expertise, including several close friends and family members of mine, and his realism and compassion brought ease and comfort to many when discussing their sarcoma diagnoses. And as Marisa Nucci said yesterday at the USCAP tribute, he just made pathology fun. I'm just so grateful for the years of his mentorship and eventually friendship, and for the many hours we all got to spend at the microscope for him. So really, it's extraordinary to think how he helped dozens of people each day in his life, amounting to hundreds over the years, often with just small gestures and kindnesses, in addition to these gargantuan contributions. And I just think how his memory and legacy will be perpetuated in turn, each of us emulating what we've learned from him in our own little ways, how we diagnose cases, how we teach at the microscope, how faculty learned through his example to mentor young pathologists and trainees, how we help each other as peers, and how we remember to show appreciation for support staff. All of us will always reflect on the advice he gave us in difficult times and the example of resilience that he gave us. So thank you, Chris, for everything.
Is there anybody who would like to stand up and say anything about a fun or compassionate experience you had with Dr. Fletcher?
I'll add one more thing just to show you kind of what he was like. So a lot of you younger people don't know this, but back many years ago, when we submitted an article, it wasn't done electronically, right? We had to make multiple copies, huge copies, Kodachrome, and then mail that out. So it was really a big, cumbersome effort. And I still have a note from Chris Fletcher on leiomyomas of deep soft tissue where he's saying to me, this is how you treat it all, though. Basically, I didn't even know that was supposed to be a concept that needed to be addressed, right? That's at the time. He said, yeah, I think this is something good to write about. We need to address this concept. And then he would edit whatever I had, and he would send me a note. It was always like, well, just look over this and let me know if you want any changes. And of course, I thought that was one of the more humble expressions that he had. He was interested in knowing what a fellow thought about a paper that was being written, right? He still was interested in what I thought. And I hope that's something that those of us, even younger people, can kind of take to the future when you interact with residents and fellows is their opinion matters. Always make them feel like they matter. And that's what was so special about him, right? He made us feel like we mattered.
Yeah, I echo that. Oh, go ahead. We have somebody here. While he's walking up here, I'll just say I echo that because Dr. Fletcher first came to visit us when I was at the AFIP. I was a young staff person. He was one of our visiting professors. And I saw him over the years at both the WHO and also at USCAP. And he was always so supportive. And as you mentioned, he was always interested in people's, how they're doing both professionally and personally, and very supportive to everybody. And I was most proud when I bumped into him on Cape Cod and he got to meet my parents, and he came over to them and he told them that I was a famous soft tissue pathologist, even though he's the famous soft tissue pathologist. So it's really just an honor for him to meet my parents. So anyway.
Oh, yeah.
Sorry, I'm Kum Cooper. I heard many of your tributes, and I don't want to repeat most of those because that's what he was. He was a real human being. Excuse me, I'm having difficulty speaking because I didn't expect to address you here today. But I wanted to go back to the first time I met him, which is 1990. And I met him at the British IAP in Belfast, Northern Ireland. And it was at the end of the day, and we were all getting into the bus to get back to the hotel. And he was sitting in the front row, all alone in a pensive mood. I went to the back of the bus, thought about it, and went back to the front and introduced myself. And we've been friends ever since. He's been my mentor, my best friend. He's been responsible for me being in this country, being here, talking to you today. And I can say that for the last year of his life, when I did not get to see him, I was in text, messaging with him twice every 2 weeks. And those memories stay with me. And yesterday when we arrived in Boston, my wife and I walked through Boston, I couldn't take it anymore because I was too emotional that Chris is not here. And so I wanted to share that with you because Julie asked me to come over and say a few words. But the time that I'd spent with him will be with me for the rest of my life. I want to share just one story because that was what brought me up here. You'll see that he worked at St. Thomas's Hospital and that he was a resident there and then left soon after that. When I visited him in the early 2000, late 1990s and early 2000 at one of his famous multi-headed microscope sessions starting at 4 p.m. There was a case of a round cell tumor in the thigh where he invited everybody to comment because he couldn't get any further on that. And I said to him, Chris, this reminds me of a tumor I saw in my final exam at the Royal College in St. Thomas's because I did my exams there in 1987. And he pointed to the fellow and said to the fellow, go to the slide box, pull that slide out, and he gave him a name or a number, pulled it out, brought it to the side. He said, that's the case you saw. And I diagnosed it as a myxoid round cell liposarcoma. And I said, well, the examiner had some doubts about it. So why did they put it in? He said, you go figure that out. That was his case. So I just wanted to leave you that story because he had a phenomenal memory that many people know and experienced. But I experienced it firsthand because he was everything you've all said, from Joe, Vicky Joe to Jason Hornick, And Dr. Nassim and Alessandra, I know her father, Tony, very well. So I go back many years, and I thought I'd share some of that story. I could go on here for a couple of hours. I'd rather get out of here.
No, thank you. Absolutely. Thank you very much.
Thank you. That's really wonderful.
You want to give the award?
Julie, I
now?
want to just finish. I just want to add one sentence about Chris. He's such an incredible host. He asked me to give grand rounds at Brigham a few years ago, and after my grand rounds and all the wonderful dinner the previous day we had, he made sure that he came all the way to the garage, to my car, and made sure that I got into the car and I was safe to get out of Boston. And I never forget that. Was incredibly wonderful to visit and be with.
It's lovely. Does everyone agree that his writing was very philosophical? It's very unique. If you read his papers, just really impressive, and his own thoughts come out. It's very well written. So, any other comments? We have one back there.
Speaking in public, but I have to share my story. So basically, that was like at the late stage of COVID years. So I was a fellow at Beth Israel, but after like if we have some time, we always go to Brigham to see some soft tissue cases. At that time, like there are only a few people who would like to sit with residents to discuss about cases on the multiple head scope. He was one of them. I remember the room was always like, there are always many people, although there's a distance limit, but people try to separate themselves, but still try to work with him. I don't know why, like I went there for 2 weeks. Somehow, I don't know from where I got virus, so I left. And then I followed up with the group, and I know that all the people that sitting with me was fine. Also, Dr. Fletcher was also healthy. I feel thankful for that, and I also feel very thankful for the experience. The learning experience was very good, and also very thankful for her teaching, for his teaching. Thank you.
Yeah, thank you. So I think go through. Oh, sure.
Oh, hey,
Good.
Alex.
So one of the things, so everybody's talked about, you know, the great advice that we've gotten from Chris Fletcher, and there was one thing that I always found really unique about his advice, because you can ask advice from lots of famous people, and as a lost soul like myself, that might happen a lot. And you know, there's pretty standard answers you can give, you know, for academics: work harder, write more papers, get more grants. But when Chris gave you advice, it was very clear that he had thought about you and what you were like and what your values were as a human being, and he would always give you advice that was consistent with that. And so the advice that I got from him over the years, which I mostly followed, was always in that manner, and it was a very unique experience to chat with him, because it's very rare when you talk with, you know, people that aren't a member of your family, that they know you well enough to be able to give you that sort of advice. And that's the way I will always remember him, amongst the many other things that are memorable about him, is the amazing advice that he gave.
Yeah, thank you.
Hi, everyone. Jason, Alessandra, Vicky, thank you for your beautiful speeches. I'm a former fellow as well, and this is why I didn't want to say anything. He was brilliant, and he was hilarious. Losing him was a big loss to our Brigham community, but I think the whole wide world as well. And I just want to share that something that a lot of people don't know is that he used to sneak out and go see patients in the hospital. And I remember he used to tell us to do the same. Sometimes just get out there, go see the patient. So he taught us to be a lot more than just pathologists. And it was so much more to learn from the patients directly, and he cared. We were so lucky to have him, and he made this world a better place for sure. Thank you for doing this in his honor.
Thank you. Thank you.
We're really honored and grateful to have Dr. Fletcher's family here. You guys don't have to stand up. I think he's going to bring you a traveling mic if you want to just say, where you traveled from and your name.
So yeah, I'm Joshua. I'm Chris's son-in-law, and as you were all speaking so eloquently, I thought I'd better make some notes. So just forgive me for referring to my phone. So thank you for having us here. I would say it's my first and last pathology conference, but actually we did pop into one in London, and it was there that we saw that the way in which he was in his lectures was just how he was in real life, pretty outrageous and outspoken and forthright, and that was quite fun to see. I'm glad to see that's now been, these keynote speeches are nearer the beginning, because the unfortunate timing of that event meant a lot of people weren't there to see what he was saying, even though it seemed very, very important at the time. But yeah, it's quite bittersweet, obviously, for us to be here and to hear all the wonderful things you were saying, just as we saw in October as well. And we just agree with everything that you're saying, I think. You were a family to him in the same way that we see many of his great qualities. He had that with his family too, appreciating everybody for exactly who they were, and their characteristics was exactly the same with his sorry. His grandchildren and his children, anybody he met ever, he would talk to them and about them in exactly the same way. So with the award, he would be very proud and humbled, as he always was, but he would also be embarrassed. And I think, you see that in a lot of the photographs, the wonderful Padua photographs. He's very proud, but you can see in his face that, goodness, what have they put me in here? And I'm sure he'd be looking down at us now and saying, for God's sake, everybody shut up and have some lunch now or something. So thank you very much for having us here. It's been wonderful to hear all your thoughts as ever.
Thank you very much. So to his loved ones, his family who's here, thank you so much again for coming. And we're presenting him with this distinguished achievement award that has really been only given once prior to this. It's a very special award. We don't have the certificate with us at this moment, but we will mail it to you, I think. We'll get Vicky Jo to help us with that. And we really just want to let you know how much Dr. Christopher Fletcher meant to this larger family, and not just his core family, but the larger group of us, both in soft tissue and bone pathology, but also in all of surgical pathology, as a person, a mentor, and a colleague. So thank you again for coming to this, and really meant a lot to us that you could be here. Thank you.